Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Episodes are available on vhha.com and on popular podcast hosting apps, including Apple Podcasts, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air each Sunday at noon on 100.5 FM, 92.7 FM, and 820 AM across Central Virginia, 1650 AM in Hampton Roads, 105.1 FM, and 1050 AM in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. I'm Will Selden, and today we're joined by Denise Butler, a geriatric care specialist with Riverside Health, for a conversation about her work, an innovative memory cafe she helped pioneer, and more. But first, welcome to the show, Denise. Thanks for joining us.
Oh, well, thank you, Will. I appreciate that.
Yeah, absolutely. I want to start, first of all, just by helping our guests get to know you a little bit better, and I'll share a few things that we know about you, if you don't mind, and then you can sort of fill in the blank. So we know you have an undergraduate.
Okay.
Yeah, so we know you have an undergraduate and graduate degrees in psychology and counseling. Your journey at Riverside Center for Excellence in Aging and Lifelong Health began as a volunteer in 2011, before you joined the staff 2 years later in 2013. But I'm sure that those professional details just scratch the surface of your, unique personal journey. So tell us a little bit more about what people should know about you.
So I had personal experience with having parent and in-law who were living with dementia and didn't have a really good experience with my mother. She was in the hospital probably the last couple of months just before she died of her life. And the hospice looks at me and goes, well, your mother has dementia. Okay, that was the first time I'd heard that. And 2-3 months later, she's gone. So, which tells you our family got nothing in terms of assistance. And I had to kind of piece together what form of dementia she has. And looking back and looking at things, she had vascular dementia. She had a lot of little strokes. And we didn't know how to deal with her. And our journey with that was very complicated and very challenging. My father-in-law was diagnosed probably 8 years before he passed away, which is kind of the average time from the time of diagnosis to the time somebody passes away who's living with dementia of the Alzheimer's type. And this was our family's experience. There was a strong family history. His mother had also had dementia of the Alzheimer's type, and we really got absolutely nothing with her. With him, it was a little bit different. It was, yes, you have dementia, you have Alzheimer's. Here's your prescription for Aricept. We'll see you in 6 months. So you're left with this diagnosis and no direction. There is nothing about, here are some things you can do. Here are some things. Here's the planning that needs to go in place for all of this. Nothing. So having been through that, my goal is when I'm working with a patient or a family or both, there's so much out there. There's so much to support you on this journey. And let us, especially here, we were a Center for Excellence in Aging and Lifelong Health. We became the Martha W. Goodson Center last year through a generous donation through Mr. Royden Goodson. You can have a good quality of life. And the focus should be, yes, we have loss, but there's always going to be something good to work with here. And there's always going to be a way to connect. And how do you best support this person who's living with dementia? How do you best support yourself as their care partner on this journey? And understanding and education is such a key piece of it. We know that we got 3 things that are important for all of us, whether or not we're living with dementia. We all need a purpose. We all need structure and predictability to our day. And we all need socialization. Socialization, this is where I'm going to bring in Memory Cafe. Those opportunities become less and less as people travel along this journey, as things progress. So one of our goals was to say, what can we put in our community that provides this social opportunity where people can go, be themselves? There is no judgment, and the people that are there to facilitate it understand what the care partner, caregiver, and that person who's living with brain change are going through. That is our goal with Memory Cafe, is to provide that socialization opportunity.
Well, thanks for sharing that background. I want to ask you about sort of the timing for this. So you shared a little bit about your why, which is fantastic. And we recently had on this podcast Dr. Siegel Breton, a geriatrician with VCU Health, and she shared a little bit about her why. And it was, similar to yours. It was, a personal moment in sort of her past that put her on this path that led her to where she is today. And it's interesting. We often see people in healthcare have that sort of personal connection to their work. So the timeline of your personal experience with memory care with your family, did you then have to just plug skills in that you already had in order to make that career, or did you have to seek that opportunity out afterwards?
So it was some of it was seeking the opportunity. I was thrown in the position, and not just myself, but our family, both sets of families, were thrown in the position of like, we don't know what this is. Things are changing. We don't know. Is this normal or not for somebody who's living with dementia?
Mm-hmm.
What should we be putting in place? At what point do we need to make some changes? What I learned, and I bring this out, and I'm very open with people. Here was our experience. This is not a good place to be. And so one example with my father-in-law, probably needed to go into memory care before he did. We did try keeping him at home. He was living with my sister-in-law and her family, and it really got to be. There was a point where sometimes it's great if you can keep them home, but sometimes they need that extra level of support that we just can't provide it in the home. And then it was, now we're in a crisis. So one of the things is, let me tell you about my experience. I want you to be thinking about this long before you even think you're going to need it. Start looking at places that you would be comfortable moving your family member, your loved one into, knowing what they provide, knowing, does this look like it's going to be a good fit? What level of support are they going to need? And is this a place that can give them that level of support? What is their understanding? So that's where I've taken my experience and I bring it into people so they know. I think it's helpful for someone to know, you've been on this journey. I mean, it was my journey, my experience, but it also means I'm not just someone that this is something that I've studied and I'm telling you about it.
Yeah, absolutely. Well, I want to dive into the Memory Cafe program a little bit more. So just a little background for our listeners. There's a body of research indicating that physical and mental engagement and socialization can slow the process of cognitive decline for patients with dementia. With that background, tell us a few more details about the Memory Cafe program, which, as you mentioned briefly, is for people with memory loss and their partners. Tell us a few more details about that, some of your observations about its benefits and some of the programming as well.
Okay, so it is that socialization opportunity. And there's a lot of information about their memory cafes. And when we were starting this, there was a little bit of trial and error in what we did and what we ended up doing. And I can only tell you what's worked for us. And this actually, the whole idea for Memory Cafe actually started with an email that somebody sent me about memory cafes. And I was looking at it, and I was also working in a support group with people that were early stage. And as things progressed, they weren't going to be able to stay in that early stage group because things were progressing. But they had formed a really strong bond with each other. These were couples. And we were trying to figure out, how do we keep this group together? What is the opportunity? And then here comes this article about memory cafes. And we have a wonderful volunteer with us, Marjorie Holkert. Marjorie was there the day I got that email, and I went to Marjorie and said, I think we can do this. And then I pulled in some other people that were also facilitators for that support group. And we started planning back in September, I want to say 2015. How would we do this? We had our first memory cafe in February 2016, and it was just continued to grow from there. Pre-pandemic, we had 2 memory cafes in Williamsburg, and with a grant, we extended into York County to the TAB Library, who've been wonderful partners with us. So it was kind of like at that aha moment, you're searching for something, and you get that answer in your inbox in your email. So we did a lot of research looking at memory cafes. There are a lot of good websites you can go to, and the things you had to take into consideration. And we did try a lot of different venues before we settled on. And we've had to move over time again. Things change. But my recommendation is someplace that's a nice public place that you have good handicap parking. It's easy access. The libraries have been a wonderful partner with us. We're so excited that the Parksley Library on the Eastern Shore is going to be starting this. So we're very excited for them to be able to start this. So what happens in a memory cafe? So people come in and they may be new, and because we're established here and in Gloucester, it's in the beginning. When you're starting one, it's a little bit hard because people aren't sure. They're not sure. It takes a little while to build it, but then people start coming on a regular basis, and they get to know each other, and they look forward to seeing each other. We welcome anybody in wherever they are on that journey, whether they're early or moderate. It doesn't matter. There's no judgment. We have trained facilitators that are able to manage if there's something that comes up. So it's that opportunity. You go and you have some decaf coffee and a brownie, a cookie, a donut, whatever people bring. We try to have nice little, like fall, we might bring some pumpkins in to decorate, have, little paper plates that have the fall decorations or the spring or whatever. So people come in and they start greeting each other, and we have tables and chairs set up, so they're kind of either in a large square or a horseshoe. We've tried lots of different things, and they sit down and get to know each other a little bit. They're sharing that companionship of having a cup of coffee, a lemonade, whatever they're having in the moment, and having that treat. That's a great icebreaker. What we found works well for our groups, and different groups do different things. Some people have planned programs. They bring speakers in. We found that didn't work well for our groups. Our groups, when we tried to do kind of a little planned activity, pretty much were not interested. They just wanted to talk to each other. They just want to be with each other. One of the neat unintended outcomes of this is they form relationships and they see each other and do social things together outside this group, which is just that nice continuation of the socialization piece. So the groups that we've had going for a while, somebody will call me and say, hey, did you know so-and-so was in the hospital? Did you know so-and-so started hospice? Or I just talked to so-and-so. Could you give them a call? I think it would be helpful if you called and talked to them. So it's not a support group, but they are supporting each other in a way. That's really just amazing to see. We have people that come in and they say, hey, I'm doing this activity. Anybody interested? Here's how you get in touch with them. It's just an amazing thing to see. I have people that have been coming for a while, and they're there before I get there. I get there like at least 40 minutes early. They want to be there. They love helping me set up. Can I help you? Hey, you want to cut the brownies? Here, you cut the brownies. Put them on a plate. Here, you want to set up the coffee over here? It really is just a cool thing.
It sounds like y'all struck that really cool balance of, being casual and just letting folks mingle and get that socialization piece like you talked about.
Exactly. And so, and especially with a group that's more established, when new people come in, these folks that are there early to help me are also there to say, hey, go up and say, hi, my name is, welcome. It really is just this amazing thing to happen as it unfolds.
And I gather that it's a free program as well, which I can only imagine is super helpful for those folks who have, so many challenges to navigate as they go down that path. So,
yeah, it's absolutely free. There is no charge. It's what I encourage people to think of it as an open house. There's no RSVP. You just come, and you can come and go as you please. You can come later. It's not that again, this is why we don't like the planned program approach. It's 1:30 to 3. If you get there at 3 o'clock, it doesn't matter. Come in, grab a cup of coffee, and sit down.
Yeah, that's
if
fantastic.
You need to leave early, it's okay too. So again, it's that nice open house. If somebody's not having a good day or they just want to drop in for a few minutes, it's all right. I have some people that drop in that the care partner will come when the person who's living with the brain change either isn't able to come anymore or they've even passed away. They will still come and participate.
That's
because
cool.
this is how strong that bond is. It really is just an incredible thing to see.
Yeah, I mean, it sounds like there's super strong community there, and I'm sure that's of great benefit to the people with dementia, but also their care partners and all their support folks as well. Like you said, I mean, they keep coming. So
they keep coming, and we try to have, with our partners, we've partnered with the Peninsula Agency on Aging for where we go in Williamsburg down to Newport News, Hampton, York County. If they've got something going, they'll bring their literature or they'll bring their brochure. So people, it's also not a little bit, if we've got something that we're going to be offering, we can put that out for people so they know this is something that's available to you. And sometimes somebody will get up and announce something, which is okay. What we've also found works well for us is, once people kind of sitting around the table and they're comfortable, the facilities will get up and they'll introduce themselves. Hi, I'm Denise Butler. I work for the Martha W. Goodson Center. My name's Marjorie Hilkert, whoever they are. And then we'll say, what we like to do is just have you introduce yourselves. Just tell us your name, maybe where you grew up, kind of what you did for a living. And the other thing that happens with that is someone will say, I was in the Navy, and you get somebody across the room going, hey, I was in the Navy too. Or I grew up in Hampton. Hey, I grew up in Hampton too. Or it's just really kind of you get these nice connections with people. So this person they may not know, they've got a connection because they live in the same neighborhood. They were in the Navy, the Air Force, the Army. One day we had 3 people that were from Germany who were German speakers. Yeah,
that's cool.
It's just kind of phenomenal. And every time I walk into a memory cafe, I never know what it's going to be, but I know it's always going to be wonderful.
Tell us about the expansion of this model. 2 things. So tell us about the expansion of the model. I know you mentioned that a new one is launching on the Eastern Shore in about a week. We're recording this in October. So tell us about the expansion of this model. What's driving it? I mean, I assume it's just because it's having a really positive impact and folks are liking it, so there's more demand. Yeah, and then also tell us, so if folks want to learn more, are there resources online that you would direct them to?
Okay, so we're expanding. One of the things we know is that there's such a need for this, that socialization opportunity, that opportunity to be with other people where there's no judgment and you can be relaxed. You don't have to worry if somebody says or does something. It's okay. It's all okay. So the expansion has been part of what we've been slowly growing this program. And Eastern Shore is an area that doesn't get as much attention as it should. And what we're trying to do, we have Riverside has a presence there, a very nice, strong presence, with a hospital, with clinics, and we want to be able to support that and support the Eastern Shore the best ways that we can. And this is one way of doing it, is to be able to offer this incredible socialization opportunity for people and give them that opportunity to get out and be with other people for an hour and a half. Just relax and enjoy yourself and maybe make some new friends that you will be able to go and meet for coffee. Or there's something, I know there are some folks that have found some like cooking classes or a dance class that they do together. It opens the door for more opportunities. We also have a grant that I believe next year we're going to be hopefully starting another memory cafe down in Hampton. And one of my goals is to also, now that Riverside's expanding more into Smithfield, we have the hospital, is to also establish a memory cafe there.
That's great. So yeah, it sounds like you said the demand is there, the expansion's coming, so folks should look out. And if they wanted to learn more about it, about scheduled sessions, locations, things like that, where would you direct them?
They can go to Riverside online, and they can look under Lifelong Health and find the Martha W. Goodson Center, and they can find that information. Or they are more than welcome to call me or anybody here at the Martha W. Goodson Center at 757-220-4751. We're happy to send out flyers, information to anybody that wants it. Anybody wants to just give me a call and talk about it, I am more than happy to talk to them.
Great. Well, Denise, thanks so much for providing all that great information and sharing a little bit with us about the Memory Cafe program. Before we let you go, we have a tradition on this show to ask our guests a pair of fun questions to close things out. So to keep things interesting, our return listeners will know we have a list of 10 mystery questions from which we will draw. So if you would, pick 2 numbers between 1 and 10, and then I'll ask you those corresponding questions to close things out.
3 and 7.
Okay.
Lucky numbers.
Okay, I love it. Number 3. What is the best piece of advice you have ever received, and why does it stick with you?
Oh gosh, what a good question. Best advice I received. Oh gosh, I've gotten so much good advice over the years. I mean, really, I've really gotten some really good advice over the years. I think probably the best thing is just enjoy where you are, and just try and be in the moment as much as you can.
You know, if somebody asked me that question, I'd probably say similar. I remember going into college. I remember somebody said, "Don't wish your time away."
Exactly.
And that's similar sort of vibe. Enjoy where you are. I like that. Okay, and number 7. This is a fun one. If you could choose one superpower to have, or any one skill to instantly master, what would it be and why?
A superpower? Oh my gosh. Wow. What was my superpower? If I could have one, would be able to bring comfort where it's needed.
I like that. That seems to be a similar theme on for healthcare folks. They always go that route on the superpower question, which makes a ton of sense. Sounds like you're in the right line of work.
You can't tell I have a passion for this at all.
Not at all. It doesn't come through at all.
Yeah.
That's great.
Yeah. No, not in the least. No, I'm very passionate about what I do, and it, I talked earlier. It's so important to have a purpose. This is my purpose.
Yeah.
Is whatever I can do to be of support, comfort to someone on this journey. That's my goal. That's my purpose.
I love it. Well, those are both great answers, and with that, we have come to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you liked what you heard, please make sure to leave us a 5-star review on Apple Podcast and subscribe so you know when new episodes are released. We want to once again thank our guest, Denise Butler with Riverside Health, for joining us today. So Denise, thanks so much. It was great talking to you.
It was great talking to you too. Thank you so much for having me.